Removing gluten, does it really help? New studies question our understanding of this common dietary protein. With a surge in gluten-free products, we investigate, is it a trend or a medical necessity? This video examines the effects of gluten on health, unveiling the risks and benefits based on current science. Experts clarify myths and realities, providing an informed perspective on this controversial topic. Gluten, a protein found in wheat, barley, and rye, has been a topic of debate in contemporary nutrition. Despite its ubiquity in the modern diet, the growing popularity of gluten-free diets, driven by both medical needs and dietary trends, leads us to question its true impact on health. For those diagnosed with gluten-related diseases, such as celiac disease, gluten intolerance, non-celiac gluten sensitivity, or wheat allergy, eliminating gluten is essential. In these cases, a gluten-free diet is not only necessary, but is the only available treatment. People with gluten disorders experience a variety of symptoms, ranging from gastrointestinal problems to skin conditions and joint pain. In celiac disease, an autoimmune disorder, gluten triggers an immune response that attacks the small intestine, a crucial organ for nutrient absorption. By removing gluten, patients with celiac disease can regain normal intestinal function and alleviate their symptoms. On the other hand, gluten intolerance and non-celiac gluten sensitivity, though not autoimmune diseases, also cause chronic intestinal inflammation and similar digestive symptoms. Furthermore, a gluten-free diet has been found beneficial in managing other autoimmune diseases. A February 2022 study found that 65% of patients with various autoimmune disorders experienced a reduction or elimination of symptoms when adopting a gluten-free diet. These diseases include diabetes, lupus, Sjogren's syndrome, Hashimoto's thyroiditis, Graves' disease, Addison's disease, rheumatoid arthritis, ankylosing spondylitis, polymyositis, dermatomyositis, and multiple sclerosis. Additionally, this diet has been observed to help manage irritable bowel syndrome, IBS, the most common gastrointestinal condition, by reducing symptoms such as constipation, diarrhea, and abdominal pain. However, adopting a gluten-free diet is not without challenges and risks. For many, the transition process can be overwhelming, requiring a complete overhaul of eating habits and deep learning about label reading and food preparation. Moreover, gluten-free foods tend to be more expensive and often contain more calories and sugars, which can lead to weight gain in some people. There is also the risk of developing nutritional deficiencies, especially if the diet relies heavily on processed foods and not on whole, natural foods. A study in women with celiac disease showed that a long-term gluten-free diet led to an inadequate intake of micro and macronutrients, including vitamin D, folate, calcium, and iron, negatively affecting their nutritional and anthropometric status. This underscores the importance of balanced and adequate nutrition, even when following a restrictive diet. In the case of non-celiac gluten sensitivity, NCGS, the situation is more complicated. Although people with NCGS may experience relief from gastrointestinal symptoms and others by eliminating gluten, diagnosis is difficult as there are no specific biomarkers to detect the condition. Additionally, it has been found that for some people, symptoms may be related not only to gluten, but also to FODMAPs, a group of fermentable carbohydrates that can be difficult to digest for some people. A recent study showed that fructans, a type of FODMAP, may cause more discomfort than gluten in people without celiac disease, but who follow gluten-free diets. For people who do not suffer from gluten-related diseases, the decision to eliminate it from their diet should be considered cautiously. Although some individuals may report an improvement in their overall well-being, there is no conclusive scientific evidence to support significant benefits for this population in general. It is important to note that gluten-free diets can lead to nutritional deficiencies if not properly planned. Furthermore, for those without a medical need to avoid gluten, eliminating this protein might not offer additional benefits and could unnecessarily limit variety in their diet. Therefore, it is recommended that dietary decisions be based on individual needs and responses, and, if possible, in consultation with a healthcare professional. Adopting a gluten-free diet whether out of medical necessity or personal choice, requires careful consideration and meticulous planning. While for some, eliminating gluten is fundamental to their well-being and health, for others it may not have a significant impact or could even be detrimental if it leads to nutritional imbalance. The key lies in individualized assessment and a deep understanding of how gluten interacts with the body under different health circumstances and conditions. In summary, while for some individuals, particularly those with celiac disease or non-celiac gluten sensitivity, eliminating gluten is crucial for their well-being. For others, it may not offer additional benefits and could even be counterproductive. The decision to adopt a gluten-free diet should be personal and informed, ideally with medical guidance, considering individual needs and responses. And with that, we conclude our journey through the world of gluten. Don't forget to hit like, subscribe for more content, and maintain a healthy lifestyle.